Hello and welcome. You're watching FII. I'm Sonal Mehrotra Kapoor. Now, COVID vaccine for kids, now a reality, at least in the United States of America, where the Center for Disease Control and Prevention has recommended expanded usage of the Pfizer-BioNTech's COVID-19 vaccine for kids between the age of 12 and 15 years. In fact, US President Joe Biden already has called it one more giant step in our fight against the pandemic. Now, this comes at a time when India and experts here have already started preparing for the third wave, and the warning is that it will be impacting kids the most. And here in the country, with over 150 million of them, India needs to get cracking on the COVID vaccine for kids. Now, I know there will be a lot of anxious parents out there watching this program with lots of questions. So only for today's episode, our phone lines are open. Let's flash that number on the screen also for you to dial in if you have any question at all. So take a quick screenshot of that and dial in every time. If you have a question regarding COVID and your kids, our panel of experts will obviously look into that. I'll just repeat the number for convenience at this point. It's 837708 8377. All right, and also there is still a lot unknown meanwhile when it comes to younger kids. Companies like Pfizer, Moderna, Johnson & Johnson, and now even Bharat Biotech is now working on trials. So we thought, let's familiarize you a little in the country about the process with which trials in kids take place and also who are the top contenders. First up, now recently Dr. Devi Shetty, the chairman of the Narayana Health, pointed out that we are likely to get the third wave, and there is a possibility that this third wave of the virus will predominantly target the children, mainly because adults are either infected already or immunized. So the COVID-19 virus has to find a new host, and the most vulnerable group in large numbers are children. He meant this for children less than 12 years of age mostly, and in India, remember, there are about 150, 160 million already. So, what should be India's strategy? 3 words really: vaccinate, vaccinate, vaccinate. And at this point, in the vaccine strategy in the country, there are a few contenders. The vaccine has already been cleared for trials, at least in India at the moment, for Bharat Biotech. Recently, we'll talk about that in just a bit. But let's look at globally who are the top contenders. Contender number 1 for vaccine in kids is Pfizer-BioNTech. In their phase 3 trials in adolescents between 12 to 15 years of age, they found 100% efficacy and a robust antibody response, and also well tolerated. The study had over 2,260 volunteers in the US, and the dosing was the same as for adults, 2 shots, and each scheduled with 21 days apart. Now, at the moment, that means if you're a kid of over 12 years in US, you are eligible for a shot. But parents of younger children will have to wait. Contender number 2 for vaccine for kids is Moderna. Very close to finishing off their trials at this point, and they are at that stage where they are evaluating the safety, the tolerability, the reactogenicity and effectiveness of their 2 doses. Again, the same doses that they're using for adults, this time 28 days apart. Now, their first candidate or participant to get inoculated was actually on the 16th of March 2021, and they're doing this study under the banner called Kid Cove, and more results are likely to come in the days ahead. But their base of trials is much larger than Pfizer. They plan and intend to enroll approximately over 6,750 pediatric participants, and they will take it beyond US. They will be trying it out in kids in Canada as well. Contender number 3, some good news here in the country. Bharat Biotech has started trials. Now, they have divided kids into 3 categories. There are kids between the age group of 12 to 18, then 6 to 12, and then 6 months to 6 years. And at the moment, the recruitment process is on. The entire process is likely to take at least 6 months' time. So we should 8 months' time, beg your pardon. So we should expect an update not before December of 2021. So there is going to be a bit of wait over there. But then the all-important question of side effects, what everybody is very anxious about. Well, the main side effects so far, same as adults, which basically include the pain at the site of vaccination, fever, chills, fatigue, and all these particularly after the second dose of the vaccine. In fact, in Pfizer's trials, they had at least 91% of the participants experience some kind of the side effect or the other. So that's really what you need to know at this point when it comes to the vaccine trials and also those above the age of 12 in USA, which has been allowed now for Pfizer to come.